All right, more and more people are popping up as you join and agree to the recording. So, good afternoon. It is so nice to see familiar faces here today. Thanks for joining us this afternoon. My name is Stephanie Kucher. I'm the Quality Improvement Coordinator at Stark-Mar, and I'll be kicking things off today. So, as you know, this session will be recorded and uploaded onto our YouTube channel. We try to make sure we get that uploaded within a week of showing. So now that the RFP has been released, questions can be asked to Stark-Mar in these Q&A sessions or via email at rfpquestions@starkmar.org. So we do that because it's a competitive process. So if you send a question to the RFP questions email, you should receive a response from us within 24 hours. And then all questions and answers will be transcribed and made available to view on our website. So this session today and the next session will only share the updates from last year to this year. So if you missed the Q&A session that goes through all the forms, you can find it on our YouTube channel that's been posted up there. The next and last Q&A session will be on Monday, December 8th from 10 to 11. And you don't have to attend if you don't want to. You'll be sent the link just like you were sent it today and probably with the previous session. But you can also forward that link to others within your organization if they're interested in coming. So if you have either not been emailed the RFP documents or maybe you can't find the email, you can pull up the documents from our website, and that's www.starkmar.org. And then on the home page, there's a green button that should say SFY for State Fiscal Year 27 RFP. So that's the same place on our website where you can access the link to our YouTube channel if you want to go to it that way. You can also find the transcribed questions and answers in that same location on our website. I think that's all I have in terms of my intro. So welcome again. I think we'll just jump right into the documents. And again, we're just going to be highlighting changes from last year's RFP to this time around. So we're not going to walk through everything like we did last session. So I'll be sharing my screen on and off. So bear with me throughout the transitions. I'm going to share our face sheet, checklist, and guidelines document first. And I'll make it a little bigger once I get it up for you on the screen. Oh, so just a couple changes on this form this year. As you can see, it opens to a table of contents. That is something new this year. Really just added it for easier navigation throughout the document. And just like with the RFP guidance document, the blue underlined text are links for within the document. So you can hit your control key and then click to be taken to whichever section you want. You can also scroll through it. You'll see these first two items, which will be the first 2 pages after the table of contents. You'll see to be completed and submitted with the RFP. So those are the only 2 forms. That hasn't changed in the past, but we just marked it here on the table of contents as an extra reminder just of what needs to be included in your RFP packet. So I'm going to scroll. There was no changes to this face sheet, so I'm just going to keep on scrolling and then get to our checklist. You may remember this page. So this is the second page out of 2 that from this document should be completed and submitted with your packet. So we really just, I'll go anywhere from significant changes to minor changes, just to be transparent with you all. We did add our proposals email on every document this time around, just so that it's easier for folks, especially newer folks who aren't used to this process, to know where to send the RFP packet. Throughout this document, and I'll just highlight here real quick, you'll see a term called expedited RFP that is renamed from the waiver. So you probably heard of the waiver or the waived RFP in the previous years. That has been updated to expedited to better reflect the process. Because with the waiver, you weren't really waiving your RFP, you were just making the process more efficient and faster because there were less required documents. So there was that name change. And again, you'll see that throughout this whole document. On this page as well, we removed language of shortened, oops, sorry, I hit a key with my elbow. Okay, of shortened versus full RFP narrative and budget, and then shortened and full personnel cost schedule. So we had those kind of teased out in this checklist here because they applied to certain programs or providers. And the reason we removed that is because if you haven't taken a look at our documents yet, you will see that there is just one RFP to complete, whether you are going to provide treatment services, consultation, or prevention recovery supports. Same with the personnel cost schedule. There's just one version now for everybody to complete. So we removed that just for clarity. And the reason that those were removed was because our current strategic planning process involves taking a look at the RFP and the processes, which we spent a lot of time doing. And so we tried to remove inefficiencies or maybe items that were duplicate or even information that we just may not use anymore. So hopefully you will see those changes, and I hope that makes the process smoother on your end. So when I'm talking about removing things from last year, that's most likely why, from that strategic planning process. I'm going to scroll down to the next page. It's our accreditations page. So we added just a few more bullets here. That is guidance about a non-Department of Behavioral Health or DBH certified provider working with one that has certification. So we had a little bit of language on this very page in previous years. A question came up in the process last year, I think even in a Q&A session. So we included our responses in additional bullet points here. If anybody is interested in partnering either with a non-certified or if you are not certified, working with a certified provider. So we did add that Starkmar must be informed of the partnership, and then if it's established after the RFP is released, we can be informed through that RFP questions email. So just a little bit more guidance on that if that is something that you're interested in. And I'm going to scroll probably towards the end of the document, so bear with me with all the scrolling. Everything else has stayed the same, just to let you know. So the last change in this document is in the fiscal forms section, and we added this notion here that at the end of the fiscal year, we will require program actuals be submitted. And I know that's not new, but you will see that you may use a P&L by program or any internal format that you prefer. And we can also provide a template if we're asked. The reason for that is because you'll see when we get to the RFP budget, we did take that actuals column out, which was the way that this information was submitted. So because that's been removed for 27, this would be the way that we can get that information on actuals. That's the last change in this document. So are there questions for Starkmar Fiscal folks? Is there anything to add on that part? I'm seeing head shakes from fiscal, so that's good. Okay. I'll stop sharing. And then we'll go to the guidance document. Pull that up here. It's shared. Okay. I think there's only 4 changes maybe, so not too many in this document. And I think we all know, if you've been through this before, it's quite a lengthy document, so I'll be scrolling. So look away if that's bothersome to you. So I'm going to go right to, I'll use our table of contents and the link, permanent supportive housing. So this section has been updated for this year. So take a look at it if you're interested in submitting an RFP for PSH programming. So that's something that was updated this year. I'm going to scroll until we get to drop in. So this is the part of the guidance document that lists really specific programs and then our expectations around them. All right, so drop in. So this is a new small section that we added just to outline our expectations if you're interested in submitting an RFP for drop-in services. So we do expect that the services will be staffed by certified peer support and will include support and or education group curriculum as part of the service delivery model. So that's something that it's not a new expectation, but we wanted to include it in this document to be transparent in case there were questions around it or you're interested in providing drop-in services. All right. You know what? I'm going to go back up to the table of contents because I feel like that'll be easier to get to where I need to go next. I go to ECMH. Oh yeah, that would have been a lot of scrolling. Okay. So we did add language in ECMH section, excuse me, about, and this has been verbally shared with current providers of the services, but we included it in here. So funding for our sites, so the specific sites for early childhood mental health should not exceed for 5 consecutive years. And so we list our reasoning behind that. And then when sites may be eligible for funding, you'll see there after 2 years. So again, this is messaging that has been, I know, verbally shared, but we wanted to put in our guidance document under ECMH to be transparent for folks who are interested in providing the services. I'm going to scroll down to our outcomes section. There we go. And you may remember we have, we start this section with the consultation and prevention, and then every program is listed that's currently funded, listed alphabetically with corresponding outcomes. And I just wanted to stop at this section just to encourage you to double check the outcomes that are listed. Some may have updated from the previous year. Let your CQI folks take a look at it too. If they're not on the call and they're responsible for outcomes. So I always just encourage you to double check the outcomes for the program that you're interested in proposing, just in case there's updates. It's always good checking that section. And then there's just one more. I'm going to scroll kind of fast, so bear with me. Scoring. Here we go. This section is much shorter than previous years. And so I just wanted to share that we had some language in here from previous years about starting with certain priority areas in terms of making funding recommendations. And because we took a look and updated our process in the RFP, that's no longer relevant. So we just removed some of the non-applicable sections this time around. Let's see if there's a chat. Oh, okay. Want to make sure we didn't have any questions. Thanks for the heads up, Stanley, about your camera. Okay. And just know that questions that come in through our chat will also be included in the transcribing and posting to our website. All right. I'm going to stop sharing so we can all see each other. Are there any questions about the guidance document and its changes? Not too many significant ones. Okay. I'm going to move to our actual RFP template. That's probably the document with the most changes. And if you haven't looked at it yet, it does look very different from previous years. So just a heads up, there is a lot. It's mostly the same information. So it looks a little different, and we'll talk about that as well. So I'm going to share. And I'm not going to zoom in on this section because it's just our instructions. I just want you all to see it. I mean, it is looking a lot different than previous years. So it always opens up to the instructions tab for you. So please reference that if you have any questions. We did have a pre-release preview of this document on October 22nd. So we presented it because it looks so different. We wanted to just give an extra heads up visual walkthrough before the Q&A session and before RFP release. Just a note, it was recorded, but we chose not to post it because there were some updates that we made to the form that occurred after that presentation. So we didn't want to cause any confusion with posting that. But then posting today's, which shows some changes. So if you didn't go to the pre-release preview, it's okay. You didn't miss anything. It was just to put your eyeballs on this new form a little earlier than release. But rest assured, we'll walk through this today. So there is, like I mentioned, no longer a shortened or full version of the RFP. Everybody completes the same one. We did add to this instructions tab, this first part, we just included a little bit of the why that led to the changes that are in this document. We also added just this bullet pointed list. It is straight from the guidance document. So if you've looked at the guidance document before, this is it's a copy paste, just a reminder of proposals that tend to do well on scoring, address, or include the following. So it's just there as a reminder for you as you get ready to write your proposal. We do have a sample RFP form tab within this document. So it's right here within the same document. We used to have a separate sample budget. And so we saved you from looking at another form or having another form sent to you through email. So if you need an example on how maybe to answer questions or what that might look like, take a look at that tab. We did the same thing with the personnel cost schedule. So there used to be a separate sample personnel cost schedule. So to save you the extra separate document, it's now a tab within the personnel cost schedule for reference if you need it. So we did add one more change to the instructions tab, and I'll make this part a little bigger for you. A note for outpatient treatment services. So if you're interested in submitting an RFP for outpatient treatment services, whether that's for youth or adult, we included some wording here on how we categorize that intensive versus non-intensive, because that's how we categorize essentially outpatient services. So in order for a program to be called intensive, it would include case management services. And that's what this is saying. And then for my visual folks out there who are like me, that maybe a picture might be a little more helpful. That's what this visual is right here. So you'll see the services typically in an outpatient setting that would be categorized under non-intensive, and then as well as intensive, that would include all 4 services. Intensive outpatient with an AOD diagnosis is also considered intensive as we look at outpatient services. So we just wanted to make that clearer than we had in the past. So I hope that helps folks who are interested in putting in a proposal for outpatient services. And of course, if you have questions around that, you can always email us. Or if you have one today, you can ask or come to our next Q&A and bring that question with you. Let's see, I think I'm done outlining some of the changes in the instructions tab, so I'll go right to the RFP form itself. And I know this is small, I'll make it bigger, I promise. But you will see on the left-hand side is the narrative information, and then on the right-hand side is the budget. And that was set up intentionally to encourage program and fiscal staff to work together on RFPs, just to make sure that each side really aligns with the other in terms of looking at a cohesive program. So that means the narrative is longer vertically, and that is also in hopes that all the columns can print on one page. If your agency likes to print off your proposal, some folks like to do that. So our hope is that the columns can fit nicely on one page. So that's just a little bit about the setup. I'm going to zoom in on the narrative piece and we'll talk about that. Okay. I'm going to go over real quick some of the areas that were in last year's RFP that we removed. So we removed that length of stay question. So if you remember, we asked how long clients typically stay in the program. So that one was removed. Same with the demographics question and the geographic areas. You know, we asked where in the county services were provided. Also, the max number of people who can be served at any given time. So those were questions that were removed. So you don't have to do those this year. The only thing that was added in this first part of the narrative, I'm going to scroll to it, is we broke out the average wait time to begin services. So we've had this question in our proposals just to begin receiving services in the program. We also included the average wait time between initial assessment and first appointment, only for treatment programs. And the reason is because those can be 2 different waiting times. So we'd like to get a picture of that from treatment folks. So for the question that has been in the narrative for years, we did add this qualifier here. So for treatment programs, we asked for the wait time to the DA. And if you're a non-treatment program, that's okay. We're just asking for the wait time to begin services. So for this wait time between that initial assessment and first appointment, we do have an option that says not applicable, not a treatment program. So if that's the case for your program, you're not submitting for treatment, you can select that and move on. But otherwise, we have wait times that align with our provider dashboard that assesses this exact same thing. So that is just one new question. We also removed that section that went long ways that asked about priority area numbers served and then the percentage of the budget. So that was removed. We do still ask for the number to be served for the various populations. So SMI, SED, severe SUD, co-occurring, and others. So that it looks different this time around. It was more towards the right-hand side and kind of listed vertically. It just looks a little different this year. So we do still ask for those numbers. We just took out that priority area 1 through 5 question, if you remember. We do have some formulas set up here in this chunk of cells, so you won't have to do anything there. They'll calculate for you. We just want to know the percentage of STARKMAR, the SUD co-occurring, because sometimes we get funding that's only to be used specifically for that type of service, and then other. So you still just plug in the numbers, and you'll see there with STARKMAR funding only. We're interested in that piece. Checking my list here, my notes. Okay. I'm gonna go to, so this is really, here's where we get to like that narrative piece. And for those of you who were with us in previous years, you may remember, I always call it that big open text box. It was question 6, and you really put the meat of your program and description of it in that big honkin' cell. And we had some guidance in our instructions tab on specifics we would like to see, so comparative advantages. And so to save providers from flip-flopping to the instructions tab versus the narrative, what we did was we broke out those specific things that have been in the instructions tab and just made them separate questions. So these are things we've asked in the past, but we just broke them out here for extra clarity, if that makes sense. So we've always asked, you know, what specific services will be provided, include the types of staff. So comparative advantages, you'll see that was one area that we asked for in previous years in the instructions tab. And so in case that got missed, overlooked, forgotten, what have you, it is broken out into separate questions here. And they're smaller sections in hopes that because we're teasing that information out, responses will be complete but concise. So comparative advantages, that was something from the previous year. And these questions were the examples in last year's instructions. Same with delivery strategies. So we've asked how our customers engaged in the program. So that's something you can type out there. Also, what's done if someone becomes disengaged. Continuing to scroll, how do customers flow through the program? So these were all examples in previous years' instructions tabs, again, that have been broken out into separate questions here. I'm going to keep scrolling. So another question, what aspects or special strategies of the program motivate or encourage the customer to do the work necessary and then move towards the performance target or outcomes, successful program completion? And that really, those questions, all of those really made up that big open question 6 from previous years. We did remove the one question from previous years about location of services. So that was something else that we removed. And you may remember this was asked in the past. It may be in a different spot in our narrative, but it's for just returning providers only. So if this program's funded currently in the fiscal year, we do ask for any programmatic, personnel, and service delivery changes. Some folks have been really good to say, employment benefits have gone up, and that's why we're asking for more this year. This is the perfect spot to include that kind of information for us. So this would just help us know if we see a difference maybe in the ask from last year to this year. Maybe you're asking for a little bit more because of some programmatic or staff changes. This is the perfect spot to include it, and that'll help us understand and maybe save us bothering you with an email asking for some clarity, like what's the difference from last year to this year.
Yeah, here we go.
This is the spot to just outline any changes if you're a returning provider. So I'm going to scroll. Okay. Here's our outcomes. So if you attended that pre-release preview on October 22nd, this section changed since then. So I just want to highlight that. It has not changed from previous years though. So I want to just clarify that. So for programs that are not required to submit data into OBIS, or that Ohio Behavioral Health Information System, that's typically your treatment programs. You can check the box to state agreement with outcomes that are in the guidance document. So that's where you make sure you look at the outcomes for your program, and if you're agreeable to them, you check the box. And you'll see here applicable programs include consultation and prevention programs, recovery support programs, and then there are some, there's even some treatment programs that don't have to submit OBIS outcomes, like your crisis programs, because they're they're quick turnaround ones, so the state does not require them. So check out your program. If it's in this list, make sure you look at the guidance document for the outcomes, and then you could check that box if you're in agreement. And then we broke out for treatment programs that are required to submit data into OBIS. We still ask for that proposal of percentages for each applicable outcome. And the reason we're still keeping this is because we need to have a baseline for the percentages across providers before removing this part from the template. So just in case you were at that pre-release preview and you're like, why did we go back to this? That's the reason. We need to establish a baseline on our end before removing it. So should look the same as previous years in terms of content. I know visually it looks a little different. Evidence-based practices and models. This has been something we've asked before, but you may remember there were a bunch of checkboxes, and then we listed the evidence-based practices or models, and then you checked what applied to your program, or you can fill in if it wasn't listed. So we just left them as open text lines. We know models change, and we just wanted to leave that open for you to include what applies to your program. You can reference that supplementary PDF that accompanied the RFP that lists StarkMar supported evidence-based models and practices. So that can be a good resource to check as you go to fill out this section. So that's another change. And one more change that I'll just outline on this section, and then I'll pause, is over near the budget side, but it's at the very, very end. So I'm going to make this bigger for you all. So this section here, you'll see it's just for if you're putting in a proposal for adult residential, crisis stabilization unit, or detox programs only, withdrawal management. So these are programs that have beds for which we don't have like a set utilization rate already established. we are asking you to propose the utilization rate for the program in the box to the right. So CSU and detox, you can fill out that section right there. If you are submitting a proposal for adult residential, we ask that you let us know the utilization rate for men versus women, because we know those are two separate facilities. The reason we added that, and you'll see later when Chris goes over the budget changes, we did take some parts out of the budget, which it's like yay for you guys. Like that's hopefully much easier for you guys to fill out, but we still need to know this utilization piece, and that got a little lost with some of the parts that we removed. So trying to gather information without adding a ton more back is our intent for that question. So I'm going to pause here. I have one more form to walk through, and then I'll hand it over to Chris, and he'll revisit the budget in this form. But are there any questions on this RFP narrative before we move on? Okay. Stop sharing. And just about everybody here is a current funded provider. So if you have feedback as you fill out these forms, especially the narrative and budget, I'd just be interested in your experience, good or bad, how that works for you. We're hoping good because we took out a lot of questions. So open to feedback if you have it. The last form I have to share is the curriculum evaluation forms. And I'm just going to pull one up. Right, let me share. And this change applies to all of the forms except the one that applies to support groups. So it applies to education groups, which is this form, prevention, and also treatment. So we just added, the only change on this form is we added a bullet here that said, if you submitted a curriculum evaluation for this group or class last year, meaning for the current funded year, has the manualized curriculum changed, yes or no? So we added that piece. It's not in support group because support group has a little different requirements than the other groups. And so this would help us as we evaluate the curriculum from year to year for your groups. So that's the only change in this form, but I wanted to highlight it just because you'll notice that. So again, this form and the other curriculum evaluation forms are only to be completed if your program that you are submitting an RFP contains a class or a group. So you would do the applicable type form for each group provided. So I'll stop sharing. Any questions on that, the curriculum eval form? Pretty straightforward. Okay. All right. Starkmar folks on the call, did I miss anything, or is there anything else you want to share about any of the documents that we went over?
I think you got it all from my end, Stephanie.
Okay. Sounds good. Well, I'll turn it over to Chris Mahaffey, Manager of Accounting.
Hello, as Stephanie said, I'm Chris Mahaffey, the Manager of Accounting, and I'm going to primarily go through the budget section of the RFP narrative and budget, and I will touch on the personnel cost sheet as well, but I'll start with the narrative and budget since that's where we left off. And I think Stephanie alluded to some of the changes as she was going through some of the documents. But I'll start at the top and just work down. So on the cost section, we didn't materially change any of the information we're asking for in this section. We just got rid of some stuff. We're no longer asking for actuals in here as well. It was confusing that we were calling back to a budget form that was filled out before you got approved funds. So we decided to take an alternate track with that. So this section now just has the direct costs, salaries and fringes, and then the indirect costs. And those categories are all the same. It just looks a little bit different, but it's all the same information that we've asked for in the past. Going down to the revenue source, it's all the same information that we're requesting. We kind of changed the mechanics on this a little bit. It used to be that the revenue kind of calculated up from various different places on the budget sheet. Going forward, the request for Starkmar funding is very cut and dry and very simple now. In this cell, you would just put how much funding you want to get from Starkmar. So that is your RFP ask from us in total. This is what we're considering your ask for the year is that Starkmar funding, and it no longer is a reference cell. It's just, you just key in the number. And then we try to take away some confusion about the open lines that we used to have. We've now kind of filled in all the categories that we consider important. We did leave an other category because we realized some folks get some funding that's not from Medicaid, Medicare, private insurance, self-pay, et cetera. So we still left that flexibility there. In the past, it was just basically Starkmar and Medicaid, and then I think 5 or 6 blank lines. So we've tried to simplify that to be very explicit about what we're searching for here. Probably the biggest change in this form is in the past, we used to have kind of a budget section where you would choose your rate codes and then put in your estimated number of rates, and then it would use an average based on the way they're grouped to come up with costs. And it was kind of cumbersome to bill. I think people had to do a lot of tweaking to get it to roll exactly up to the revenue number they needed. Now you just have 2 columns of the non-Medicaid and Medicaid eligible rate codes. These mirror the way they're described on your current rate sheets, and they also mirror the descriptions in past RFPs. They're just no longer a calculation field. So now basically you're just giving us the information on the codes that you hope to bill in this program. And then we will build your rate sheet from this. And you just go through here and you select all the codes that you're going to be billing, and then that's providing that information to us. There is one place where we're still asking for some additional cost information, and this is so we don't lose this piece. There are certain programs that are eligible for administrative costs or some of the housing programs that require funding that isn't either non-Medicaid unit or Medicaid unit. It's more of like a specific code for that program or admin. What we're asking for here is for folks to select any codes that are appropriate to them. And in most cases, you'll be able to see these codes on your current rate sheet in the non-Medicaid section. But administration is a great example to this. We have several programs that have some sort of administrative component that we reimburse. And we just need to know the amount that you're asking for in that number up above. So that number up above was 150,000 is what you need in total funding. We want to kind of isolate the amount you're saying you need for administration for this program. And, for an example, I'm just going to say you need 12,000 administration, so we can build those appropriate rates for you all. And on the housing codes, it's very similar. You might say, I need 400,000 of this housing code. And that's kind of where we're going to use that section that Stephanie talked about, because that's how we calculate the rates now, is we use like the amount that's necessary to run it based on the number of units. Or sorry, the number units is a bad choice word, the number of beds typically. And then we use that kind of utilization rate or occupancy rate to kind of, understanding that beds aren't full 100% of the time. There is some wiggle room there. So we use that information as well. These codes should be very familiar to folks using them already. If you're a newer provider and you think you're going to be providing some of these types of services, I'd say this is a perfect opportunity to reach out through that RFP questions and say, hey, I think I should be billing admin for this program, or I'm doing some sort of housing program that's new to the organization. I don't have anything under there. How do you want me to convey that information to you? And we'll just have some conversations about it. And then come next year, you'll probably see your code in this drop-down list. That's really it on the budget section. We're asking for all of the key information we needed before. We hope we've made it much simpler to deal with in that it doesn't like do the building revenue. You don't have to try to estimate units to get to the revenue you need. I will pause for any questions about that budget section before I flip over to the personnel cost sheet. Okay. I didn't have any questions. Personnel cost sheet is, as Stephanie said, we've gone to one sheet again, because again, it was confusing for folks to know which sheet to use for which program. We got that feedback quite a bit. Like, I didn't know if I should do this one or this one. So we've simplified and said, let's go to just one sheet, one form for everything, and then try to take out information we don't need. This is very similar to the prior year. We did remove a couple of the, I guess for lack of a better term, like just kind of general information requests in here. I think we got rid of a couple of questions that we were asking there. We did highlight that this treatment model certified is for treatment providers only. And the big change that we made in this is if everyone who's done it before can remember, we used to say, give us the position, give us the total cost of the position. And then you had to choose percentages to allocate out to programs. So it was, again, you were trying to do that kind of math to get into where, like, if you had a person split on two programs, but they're not 50-50, you had to kind of decide based on cost. Oh, maybe they're 52-48 if like 50-50 wasn't the exact right thing for your budget. We've eliminated that. The fields are now just key in of salary and benefits, both direct and indirect, so that hopefully it won't create as much problem in building those budgets forward. So now you would just key the total cost, and then you would key, the amounts in for those individuals directly versus having to force a calculation. And that really is the only change there as well. Kind of as in the past, we do have the sample that kind of walks you through an example of how to fill one out. And that's the same for the budget and the RFP narrative and budget. I will pause for questions on that as well, or questions on anything we've covered today. I will remind folks, Stephanie brought up the other session. I don't remember the date, so she'll have to hit us with that here before we sign off. That's another place to come back and ask questions as you start to fill these out. Either that or the RFP questions email, which we've got a few in already. And I think like the first one we got, I think Stephanie replied to that day, maybe even within the hour. I'm not saying always expect that type of service, but we do endeavor to answer those as quickly as possible, because we realize you guys are working on these and you don't want to wait 3 days for an answer on something. I feel like anything that I've had that's been complicated in the past, I've reached out to someone if it was complicated and said, hey, I'm working on this. You're not forgotten. Let me get you the best correct answer. And I guess I'll leave it open this last 10 minutes for any general questions. And if not, I will flip it back to Stephanie to close out.
Doesn't seem like there's any questions right now. I'm kind of looking at faces, and I think our chat is good. All right. We can get about 10 minutes back to the end of our Tuesday, but thank you all so much for coming today and for your time this afternoon. Like we've said, questions asked throughout these Q&A sessions and sent to the email will be transcribed and posted to our website. The next one, like Chris alluded to, our next Q&A is December 8th. I believe that's a Monday. So that'll be the last one. So you can come to it. We'll be going over the same information, so you're welcome to come if you want. You don't have to. You can bring questions at that point. Maybe you'll be working on it and, maybe have some specific questions. So please bring those to the next Q&A or drop them in that RFP questions email address. And again, this session has been recorded and it'll be uploaded probably within a week to our YouTube channel. So if you need that as a reference to watch again, you can check it out. Or if you need someone else to watch it within your organization should be available within about a week. So thank you again, everybody. Have a good rest of your day. Take care.